Actually, you'll be surprised that among all the family planning methods, there's none which is 100%, including the permanent method, the one that you tie the tubes. So when you're having that conversation, one of the things you have to tell the couple is that this is 99% effective. This is 99.9% effective.
Exactly.
So there's a 0.1% chance of conceiving.
Yes.
Incoming from the east, the west, the north, and the south. This is Ask Your Gyno series. We are back on studio again with Daktari and a guest. She will introduce herself later. Here, I'm your host. I'm Faith Ngavi. Welcome back to another episode. And today, maswali yenu yalitufikia, and today we are going to be talking about fertility, infertility, and also family planning options. So you're welcome. Karibu sana, Daktari.
Thank you. Thank you, Faith, for having me here. Dr. Karanja, always happy to be here and always ready to answer to your questions. I'm a consultant gynecologist here in Mombasa, and you're welcome.
And our lovely guest.
Thank you so much for the invite. My name is Dr. Mitei Chepogen. I'm a consultant obstetrician gynecologist, very passionate about women's health.
Karibu sana, Daktari. We are on studio, and here, maswali zina flow. Kibao sana.
We're ready.
You're ready. And just to kick us off, tell us about the options, the family planning options available for people.
So when we talk about family planning, we like to divide them or classify them into three ways. So we have the short term, we have the long term, and then we have permanent methods. All of them are either covering women or men. Women to mean young girls and young men, and also older women and older men. Okay, so when we go to short-term methods, this includes things like the emergency pill, the contraceptive pills, that's combined oral contraceptive pills, which you take every other day for about 21 days of the month. Some of the pills could go to 30 days, but the 7 days is a grace period. So it's a different color of pills when you look at the package. And then we have what we call, people like to call it depot. So it's a 3-monthly injection that you get on your arm, the arm that you don't use the most. So it's the non-dominant hand. So when we go to the long-term methods, then we have the ones I would call, we give them either intrauterine or we put them somewhere in your body. I'll explain where exactly in your body. So intrauterine is basically the coil. So the coil, we have two types. One is the hormonal type, and then we have copper T. I think people are very familiar with copper T. We use the hormonal coil as well for many other things apart from family planning. I hope we'll discuss that later. Then we have what people like to call Jadel, but it has many names. Jadel is a company name, but to just generalize, the name is supposed to be implant. So it's an implant. Again, we put on your non-dominant hand on the side that's hidden, because you do not want everyone knowing that you're carrying something. Or with AI technology happening right now, people could be thinking you're transmitting information to some other alien world. But yes, we keep it in a place that it's hidden on your non-dominant hand. Now, when we go to permanent methods, we have now methods that include vasectomy, which is basically cutting the tubes that carry the sperms to be able to fertilize the egg. And then we have what we call BTL. So it's bilateral tubal ligation, where it's the woman having their tubes cut, for lack of a better term, so that even the sperms do not gain access to the egg. Okay. There's one more method that we didn't talk about, but it's still I didn't mention during the classification, but it's still a method of family planning. Condoms, both male and female condoms. Yes.
Thank you for that. I've even learned some, the BTL, I didn't know about it. I'm able to learn, but you can probably tell us about the methods, the best method for somebody. Dr. Karanja.
Yes.
What method can be best for somebody?
There's no best method for anyone. And there's no formula for knowing this is best for you, this is best for the other person. There are some questions we'll ask, maybe just to guide us on which one will be preferable for Faith, which one will be preferable for Anne, and which one will be preferable for the other person. Now, first of all, she's mentioned short-term, long-term, and permanent. So if someone has had like 4 or 5 children and they have the desired family size, most probably they will prefer a permanent method. So for those of us, you'll advise on the permanent method, like tubal ligation. For the man, you can give the option of vasectomy. We'll come to that discussion later. But most of the women either go for short-term or long-term. And by short-term, we mean if you're planning to, let's say, conceive in a year or 2, you don't want to put family planning that will go for 10 years. Okay? But also depends. You can actually put family planning for 10 years, like the coil, but you remove it after a year. It's not a must you have to wait for 10 years. So there are many factors you do consider. Age is also a factor. You don't want to use a lot of hormonal drugs for the young. Let's say 18 years to 25 years. The other factors you look at are the side effects. Because I have to advise you the effectiveness of the method and also the side effects.
That's true.
So if a woman has had menstrual issues before, you'll want to avoid the hormonal method because it might worsen
The situation.
Yes, the situation. And the opposite of it, you might actually find the family planning itself might actually treat the problem that they have. Because if you're having irregular cycles and you're planning to do a short-term method, we can advise you to take pills because pills can regularize your menses. So if you have irregular menses, maybe you have prolonged bleeding, the pills will serve 2 purposes. You serve the purpose of family planning and also regulating your periods. The other bit we do consider is we'll ask you if you've had any chronic illness before. There are some conditions if you have, you're not advised to use certain family planning method. And the most common one is if you've had hypertension before, you've been treated for hypertension, there are specific hormonal drugs we will not advise you to take. So there's a criteria we use. The other bit is breastfeeding, which we'll handle later. There are some family planning methods you cannot use when you're breastfeeding. So there's a criteria. So that unless we sit down and plan, we cannot say this is the best for all of us. This is the worst for all of us.
That's true.
Yes.
And we do have the women who conceive. They're using the family planning, but they still conceive while using the family planning.
Yes.
So how do we tackle it? Because you see, they'll end up going like, daktari alinidanganya. I wanted her 10 years.
Yes.
Kaniwekea, but I still conceived. We do have the such cases. They are there. So how is it? What are these different methods that the women can use? You had mentioned both women and the men and the women. So what are these different methods and how come others conceive while still using the family planning?
So I would say this and make it very clear. When we use the family planning methods correctly, and if we insert them as now the medical personnel correctly, if it's a coil, if it's done correctly, if it's an implant, if it's put correctly, and now the conversation we had with the client, and they know exactly when it expires, then it should be effective. But remember, nothing is 100% effective. So in every family planning, we always have to discuss. There's that percentage, a very small percentage, that can fail. So it's a discussion we need to have with our clients. As Dr. Karanja mentioned, when we are talking about the criteria that you can use, then that's also a discussion that needs to come up. So yes, you can conceive, but if it's done correctly and you follow the advice by the doctor, then it should be able to work effectively.
It should be.
Yes.
Actually, you'll be surprised that among all the family planning methods, there's none which is 100%, including the permanent
Yes.
method, the one that you tie the tubes. So when you're having that conversation, one of the things you have to tell the couple is that this is 99% effective. This is 99.9% effective.
Exactly.
So there's a 0.1% chance of conceiving.
Yes.
And these are affected by many factors. How it's for the coil, how it's inserted, if it's in the correct place. For the pills, are you taking your pills every day? Are you skipping a few days? Maybe the man has traveled and you're saying, so jamaa ameenda, wacha nipumzike. You might get pregnant. So none of them, including even the injection and even the implant, we do have people who get pregnant while they are on the family planning method. So sometimes it might not be an error in the medical personnel, because many will say, mbona niliwekewa na nimeshika mimba ama haikuweka.
And it's a concern.
Yes, and it's a concern. And you can imagine you have a coil and you're told you're pregnant. So the uterus is carrying two things. It's a coil
and the baby.
Pregnancy.
Yes. So you need to be advised. And in case you conceive, what happens?
Because it is very crucial. You can imagine when you have something.
Yes. The other bit for the coil and the implant, there's a way you check. You're going to check every now and then.
Okay.
Like for the coil, if not the implant, you're told to feel, to palpate, to feel for it. Because sometimes it can
move.
It can move. Now for the coil, you can actually feel the string. And we should advise at least do a scan, if possible within the first 6 weeks after you place the coil. Then after that, later you can still do a scan after 6 months or after 1 year, because it's been shown that it can actually migrate. Yes.
Just to add on to the coil, sometimes we put them just after women have delivered. We call it postpartum IUCD. And those women, we then advise them, because there's some type of discharge, including blood, that comes after delivery. So we would like you to be able to check your pad as you're changing. If you see it's come out, then come back. We'll either ask you to come later for reinsertion or plan another way of family planning as per our discussion. So yes, there are ways you can actually keep checking if it's still there. Yeah.
And does it affect intimacy?
No. I think it's a topic both of us want to answer, but I want Dr. Karanja to answer in terms of, yes, we've had patients who say, bwanangu anasema anaisikia ikidunga. So, Karanja, could you?
You know, when you put a coil, there's the string part that we usually leave. So that later when you want it removed, we can just get the string and remove it and pull it out. Now, if the string is left longer, like there are women, you do a cesarean section, then you put a coil. Usually we don't cut the whole string. You wait until the uterus goes back to the normal size, so the string might be longer. So after 6 weeks, we usually come and reduce it.
Trim it.
Yes, you trim it. But there are still men who will perceive or they'll feel the string. Sometimes it's psychological. Sometimes it's true. So the point is just you come and trim the string. Yes, you make it a bit shorter.
Okay.
Yes.
There's also a place, Dr. Karanja, we try and hide the string. We call it the posterior fornix. So it's just behind the cervix. So I'll be able to see the time I want to remove it. But then because it's folded, then that edgy part that the man says they feel them, then
they cannot feel it.
Yes.
Because it's a concern.
Possible.
And what are the potential side effects of the family planning? What are the potential causes?
And that's what the first thing the woman will ask. Not even the effectiveness. They ask, what are the
side effects? Yeah.
And the most feared is the hormonal, of course. And we have several side effects, but your menstrual cycle might be altered. And it can be altered in different ways. Like I said before, there's no best for faith, there's no best for until you try it. So one of the side effects is you can get irregular periods or prolonged persistent bleeding. And mainly that one affects the depot, the one for the injection, and the one for the implant. And sometimes the bleeding is unpredictable. There are ways you manage it if you have such a side effect. The drugs will give you. And for most women, it will stop and the periods will go back to normal. Now, those who don't respond to the treatment and you keep on bleeding 3 months, 4 months down the line, there's the option of removing. So it's not a must that if you have an implant of 3 years, it has to stay for 3 years. No, it can be removed if the side effects are unbearable. The other common and feared side effect is weight gain. Yes, I can see your.
We have to watch this weight now.
Yes, and some actually reduce weight. Yes, there's some women when they use the hormonal method, their weight reduces. There's some the weight increases. And of course, when the weight increases, it's a big concern to women. So what we shall advise is, it's not only the hormonal method that will make you gain weight. So there are other things you do, lifestyle changes, of course, balanced diet, but you also limit exercise, alcohol. So sometimes you might say the weight has increased because of the contraception, but when it's removed,
you still gain weight.
So the result might not be necessarily. Yes. Now for the coil, the first few days you might get cramps and spotting, but there are women who their periods become heavier when they use the coil, despite it being hormonal. So those ones we also treat. You treat the symptom as it comes, but unless the symptoms are unbearable, that's when you remove or you stop the family planning. Now for the coil, there are many women who say you'll be told your coil, you can't see the string. Yes. So you wonder how you're going now to remove the coil. So the string can either cut off on its own. The string can coil back in the womb. So when we are going to remove it, we can't see the string. So there are other instruments we want to use so that you can grab the string and remove it. But so long as the coil is well placed, when you do a scan, you see it's within the uterus, then you don't need to be worried. So there are side effects, yes. I've just addressed a few. But there are also measures to address the side effects.
That's true.
Yes.
And the cost of this also varies. The cost of the family planning varies from the different.
Yes. But family planning is generally cheap. Yes. It's generally cheap.
In some facilities, it's actually free.
It's free.
Yes. Most of the time, if it's charged because of the service delivery, the person giving it to you, and the things we will use, gloves, all that. But most of the time, yes, it's very affordable.
Okay. That is good. And what are family planning options for men? We've heard of family planning options for women. Wanaume wanajipenda. Do you have options? Wasichana wao tumejua, tumesikia hizo zote, the implant, the coil. These are women.
Yes.
Wanaume tutafanyia nini?
There's someone who asked me, and let me ask you as Faith.
Okay.
This is outside medicine. If you are told your man is using pills every day for family planning, are you going to be comfortable with that? As in, are you going to trust that man to take those pills every day?
No, but actually for men it's hard.
It's there's the social part of it. But we do have, just to answer your question, we do have the condom. That's the barrier method. But for the condom, you have to be very disciplined. Very disciplined. Because you have to use it the right way, how to wear it, and how to dispose it. Because there are many people who've used condoms and the women get
Pregnant.
pregnant. Yes.
You forgot when to put it on. Sometimes
Yes.
more than halfway they wear.
Yes.
Mama inapita ya kule pole ilipita.
Wacha ikwende.
Iende tu.
The other method is vasectomy. Now that is permanent.
Mm.
If you've come to the decision that you have your desired family size, for some it's 2, for some it's 5, you can have that discussion with your doctor. Either you opt for tubal ligation for the woman or vasectomy for the man. Vasectomy is where now the man, we tie the tubes of the man.
Okay.
And it's a permanent method.
Mm.
And I want to reassure men that when we tie the tubes, it doesn't affect your manhood. You still perform the way you usually perform, sometimes even better, because you know your woman is not going to get pregnant.
No stress.
Yes. The only bit that we avoid is the sperms. The semen will still be there. You will still ejaculate, but now the sperms will not. Because, yes, that's how you don't get pregnant. Yes. So there are options. The most important thing is discussion and to reassure the man that he's still the man.
Haijambadilisha.
Haijambadilisha.
Yes.
Yes. So there are options for men.
And is there a way to undo like the permanent decision? Like you initially will come I want to go to say, but you halfway you're like, maybe I can undo it. Is there a way?
Yes, it can be reversed.
Okay.
But we usually advise as gynecologists, if I see someone and they want a permanent method and they're considering reversal, that option is not for them. Yes. They should decide it's permanent. Now, later in life, in case now they want to reverse, there are options on how to reverse. But the chances are very low, very minimal. For the woman, it's possible to reverse the tubal ligation. For the man, it's possible to reverse a vasectomy. But the success rate is very minimal. Yes. So if you are picking up that option, then reversal should not be a discussion.
Yes.
If it becomes a discussion, it means you're not ready for that.
You're not fit for it. Yes.
Permanent method.
So mostly, so now you can't advise him, probably a man in his 30s, because to probably akiingia in his 40s, they might want that. Ile lazima unakutumwa around. So anaangalia like, maybe I should reverse it. So it can. This is a discussion that also they need to have before. And what are some of these that we've talked about the potential side effects of family planning, but does it have health benefits? Does family planning have health benefits? Kando na the side effects?
Yes, they have health benefits that are not medical. Okay. So I'll start especially with the women. A lot of women have reported to us that they start to glow. Okay. We've also had discussions with dermatologists, and sometimes we actually use it in the treatments of acne. Okay. So that also makes you glow. I mean, all women want to glow, isn't it?
Yeah.
So I started with that because, like I said, I'm very passionate about women's health, and that includes how you look and how you feel. Other health benefits for a woman, if you want to pause reproduction to advance your career, or you need to travel to work elsewhere away from your family, then yes, that also works in terms of spacing and also just being able to continue with your life as you pursue the same. Be the mother that you want to be, but at the same time, the career woman. Yes, the career woman. Exactly. That's the word. The other thing is we've had other conditions that we have noticed with scientific evidence that it has benefits. So we have issues with, like, you might have had adhesion. So the uterus is like stuck together. So we use the coil to try and open it up. Okay. So yes, sometimes we don't use it purely for contraception. Sometimes it's treatment of other conditions that are gyne, but not really because we want you to have contraception. And then sometimes we have women who have very heavy bleeding. Their issue is not contraception. So we call it menorrhagia. or they have a circle that is all over the place. They're not able to know, when am I getting my next period? So we use that in terms of trying to regulate your cycle, or to reduce the number of days you're bleeding, or the amount of blood you're losing during your menses. So yes, those are some of the benefits that I can recall of it. Is there any that I could have missed out, Dr. Karanja?
If you're using family planning, and there's no risk of getting pregnant, even the libido will
definitely go.
You're not worried.
You're not worried. That's true.
Yes. Sometimes if you are using the you're not using the family planning, and you are in your unsafe days, it becomes, there's friction. That's when your libido is high, and you cannot do the action. But when you're using family planning,
yes. And you also mentioned, Dr. Mite, you mentioned about the women who have just given birth, and you can still do the family planning for them. So does it have any effect for their breastfeeding, and if anataka kuweka family planning, will it have any effect on her, on the child?
So I'll pick it up from when Dr. Karanja talked about the criteria. There are certain methods that completely, we say, are not fit for a woman that is breastfeeding. The reason being, it can be excreted. Inaweza toka kwa maziwa ya wakati ananyonyesha. So again, it goes back to the discussion where we discuss with the woman. If you're breastfeeding, how old is the child? And how long do you want to use this method? So yes, there are different ways, and there are some that we completely do not use during breastfeeding. Yes.
And as she had mentioned earlier, there are some family planning methods you can actually use immediately after delivery. Yes. You can put a coil during cesarean section. You can put a coil after delivery, even within the first 6 weeks. There's some hormonal drugs you can use, even before the 8 weeks that we usually advise, 26 to 8 weeks. Because the problem usually is, after delivering, you'll go stay at home. Then after 6 weeks, 8 weeks, you're like, okay, but periods are still not coming. So it means I'm not fertile.
If you do.
By the time you meet again with your gynecologist,
You're pregnant and
6 months pregnant and you're still breastfeeding. It happens a lot.
Yes.
So we usually advise we should have that conversation before delivery, during delivery, and immediately after. Yes. So there are options.
Thank you for shedding so much light, Daktari, on Madaktari on family planning, because it has been a topic that is, I can say, haina mwisho. It's a circle. It keeps on coming up and up, because this is something that people are using on a daily basis. There are those who want to use. So, Dr. Mite, what is it that unaweza malizia aje? How can you?
I think I would love to specifically address the women and tell you that family planning works. Just see your gynecologist before using. It can either be during your pregnancy, before your pregnancy, and we will discuss, depending on who you present as, I will be able to tell you, or we as gynecologists will be able to advise you which method works best.
Dr. Karanja, utawaambia nini? Mandume pia wasikie.
Maboys
wako wasikie.
Now, to the men, family planning works, but it's a journey. If your woman is using family planning for 3 years, for 10 years, it's good you get involved. Come to the clinic when they're being advised on the family planning, understand what it is, understand some of the side effects, because that later, when the side effects happen, you'll understand her better. And lastly, we have options for men. Kuja tuchape story, tujue the side effects na effectiveness.
Asanteni sana. Now, on to infertility. Why is it most of the time people consider that infertility is a female problem? But we do have men also who can be fertile.
Yes.
Shed light on that.
Infertility is not for women. It's for a couple.
Yeah.
And studies have shown that even with real life experience, approximately 40% of infertility cases, it's the women who are affected. Another 30%, almost 30%, it's the men. Then another 30%, it's both. So you might be treating the woman, and yet the man also has a problem.
Yeah.
So we should advise the first visit they come, or if the first visit one of them comes, it's good that the second visit both of them come, so that you address both of them. You explain to them this might be the cause, this might be the reason, these are the tests that you need to do for both, not for the woman only, for both. But as we know our community and let's say our setup, if a couple stays for long and they have not conceived, everyone will look at the woman. Even the man, he will be the first one to say, "Wenda ukapimwa." Yes. So even us as gynecologists, we understand that. But we shall advise come both of them so that journeys you move together. Because getting pregnant is
Some people's true.
not by excuses.
Yeah, it happened once too. And what are some of the causes of infertility?
So some of the causes of infertility, again, like you said, it's men and women.
Yeah.
So I'll start with the men because probably the list is shorter. Okay. So for the men, at times it's hormonal. So certain hormones that men are supposed to have in a higher percentage than we do, specifically testosterone, among other things, could be lower, and hence now prevents fertility, depending on where ile shule ulienda. Yes. So it could be hormonal. It could be a previous infection that could affect ile barabara sperm inafaa kupita. So there's a blockage somewhere. Either it was not treated or it was treated but not well.
Yeah.
Okay. So some blockages on the tubes that carry the sperms, that could be one of them. The other thing could be congenital, something you were born with. So most of the time nowadays, even before, but we are doing it more nowadays, is when a baby boy is born. We need to know where are the testicles, where are the balls. Because sometimes if they are high up, God created them to be down so that they can be in a certain temperature. So if they're in the wrong place, it's like we are frying them. So when you fry, you're killing the
sperm.
Yes. So basically, that is the third reason. I can't seem to think of another reason apart from those three majorly. But if Dr. Karanja, you want to shed light to fellow men, is there anything else?
Now, for the men, you see, for you to conceive, there's a very big science behind it. She's just summarizing it for our audience. But the science is quite extensive. You need the organs to be there and to be normal. You need the hormones to be normal, both for the woman and the man. And you need the brain. Because the brain is like the ignition. Because there are hormones which are produced in the brain, which go now to the reproductive system, which is now supposed to regulate the cycle for the women and to regulate the manufacturing of the sperms for the men. So it's a whole system that can be affected. That's why you need to come and tests are done as an examination. There's a history we take so that you try and get what could be the cause. And maybe to finish it off, a good percentage of couples, you find no cause. You do all the tests that are there in this world, and if you don't find any cause, there's a way we address that, which I think we'll address later. Yes.
And the one on women, you've mentioned infertility in men.
Yes.
What of in women?
So when it comes to infertility in women, again, I'm going to say they're structural, they're hormonal, and like Dr. Karanja has explained, unexplained.
That's true.
Yes. So when it comes to structural, I mean how the womb has been created. Is there a problem on the ovary? Is there a problem on the tube, which is where fertilization happens? That is, the egg meets the sperm. Is there a blockage? And then inside the womb, is the house ready to receive a baby? Or there's something preventing the baby from being implanted? If my house is raining, I cannot live in it. So it's not, people think fibroids is one of the causes of infertility, but really not all the time. It could be, but not all the time. People conceive with fibroids. So there could be other issues going around the uterus that could be making you not be able to conceive. So things like endometriosis, things like what we call adenomyosis, okay? Or things like infections in the uterus, endometritis, not endometriosis. Tritis means an infection. So, and then now we have the hormonal issues. Are your hormones balanced? Okay. There's one very notorious hormone that I hope Karanja will talk about later. It's called, people, in layman terms, it's stress hormone. Scientifically, it's cortisol. If that is messed up, it messes up everything. Now, the thing with hormones is every hormone depends on the other one. So if one is messed up, it messes up the entire cycle. So that is another reason. And then lastly, like we said, unexplained. So everything is okay on your side. Everything is okay on the other side. All you need is patience. Okay? However, that does not mean I dismiss you and say, just wait. For how long can you wait? Remember, there's also the age where we tell you it's very good to be able to get your child before 35. I'm hoping we'll discuss about age related to fertility later. So sometimes that age is also a factor, okay, in terms of getting a child. Other conditions could stop you from getting a child. Thyroid issues, hypertension issues. We could tell you, please, if you get pregnant and you're hypertensive and the pressure is behaving like we're seeing right now, we might end up in a very critical situation of having to balance, do we really need to have this child, or we're going to lose you, the mother and the child? So there's a lot of preconception counseling that I would say we as healthcare professionals have not spoken enough about it. So we could address in terms of getting pregnant, and probably these issues of infertility would have been dealt with if we had that preconception counseling.
Yes. And what about the times where somebody, they give birth, probably in their teenagehood or early 20s, then they spend quite a long time for getting a child, and they probably think, have I become infertile? We do have such cases.
Yes.
It does happen.
Yes.
So are there any causes for that?
So I would say getting pregnant once does not mean you're fertile forever. Remember, I said the infection that could cause the pathway to be blocked. So yes, I could have conceived now, but then I get very difficult situations getting my second or third baby. So that also needs to be assessed. Again, I will say, please insist on seeing your doctor because you're planning to get pregnant. See your doctor. Let's make sure everything is okay, including avoiding miscarriages. That is also something we talk about during preconception, because you could be miscarrying because there's certain things you're lacking in the body to be able to make a baby. And then you keep miscarrying, and then now we keep having what we call MVA. It's a procedure we do when you miscarry. That also sometimes, if overdone, can also be a cause of infertility. If done in backstreet, for lack of a better term, that could introduce infections that later now block the tubes. So yes, it's good to always have your doctor. Don't go to your doctor because you're sick. Go to your doctor to also gain information. It is your right, and we are here to help you. We would love to discuss more about fertility with you even before you walk the journey.
Daktari, infertility is becoming a common case in this age as opposed to the prior ages, or rather the prior generation before us. What is lifestyle changing something in us? Is lifestyle changing our well-being?
Yes. Now, you see, several things have come in civilization.
That's true.
The original organic foods we used to take, Now we have a lot of processed food.
Yeah.
There's the issue of alcohol. You know, the data that has been shared in the country, how alcohol abuse is very high. We have common drugs. Drugs have become common in the streets. So it's more of the life changes that I've learned to infertility. You can actually do all the tests and find they are normal. And you just tell them to do a few lifestyle changes, and that addresses everything. Now, we also have the what we call chronic stress of this life. You know, the current life. Expectations, work issues, marriage issues. Stress only can affect your fertility, because for the women, it will affect the cycle. Okay? And as Dr. Mitei had said, if you only affect one hormone, you almost distort the whole of this, every other thing. I will also say in terms of marriage, our old forefathers, by 20 years, because there was no going to school. So by 20 years, you're married. Now, these days, you stay, there's the academic issues, you want to complete your master's, your PhD. Now, studies have also shown that the older you get, close to 40 years, and especially for women, the ovary, the quality and the quantity of the eggs goes down. So if you start trying to conceive above 36 years, it might take time before you conceive. Yes, because of the quality and the quantity of the eggs. So there are many factors that contribute. Yes.
So Mitei, anything you can add on that?
Yeah, so I would pick up from lifestyle changes in terms of the foods we eat, like Dr. Karanja said, and then how we control stress. Stress is not easy to avoid, but if we can have distractions, should I call them distractions? So exercise, do something to relieve yourself of the stress, that could get better. There is also one particular infertility-related condition called PCOS. So polycystic ovarian syndrome, a lot of times just exercising and trying to lose a bit of weight reverses, and a lot of our women conceive. So, and then the last thing, and this is especially because it's not something we want the women to stop, but we've had situations where I am pausing my reproductive career because I can't get pregnant right now. I want to grow. We're not saying get pregnant because your age or your egg or anything is. But yes, that has also contributed to infertility, taking long before you decide to get pregnant. Are there options we can address with that? Because again, like I've said, we do not want to discourage women from growing. So in the West, people have been able to freeze their eggs and get pregnant as far as above 45. Is it an option available in Kenya? Yes. The only disclaimer I'll give is it's very expensive. That's all.
There is one thing you tackled on, which is the age, and it's a question that had been raised before about somebody who can conceiving above the age of 40. And also we have two types of people. Number one, they conceived in their 20s, then they had a break for their career growth, and now we have the anataka endele past 40, and there's the one who's past 40, this is their first time. And Dr. Karanja, you mentioned about the quality of the eggs. It affects both whether you had a child in earlier and right now, and this is also your first time. It affects. That's a growth.
Now, in terms of the age, when a girl is born, they have the eggs that they are going to have it until when they reach menopause. There's no eggs that are added as there are some organs that grow. But for the number of eggs you have in a girl after they're born, they can only reduce. So as you get into your menstrual cycle, adolescent, they've already reduced by a big number. Now, when you start your menstrual cycle, each menstrual cycle, the number of eggs reduce. And it's not only one. Now, by the time you reach 40 and you're almost getting to menopause, both the number of the eggs plus the quality of the eggs reduce. So age is a very big factor. And like Dr. Mitea said, if you predict that you might reach 45 and in between you're not ready to conceive or get pregnant, you can actually freeze your eggs. There are famous celebrities like Naomi Campbell. At 50 years, she'd frozen her eggs and she ended up maybe at 50 years. Yes. But you need what?
Money.
Money.
But it's possible. But as we practice it, as we go along, and many people want to do it, the charges will come down. The cost will come down. Yes.
So the freezing of eggs is offered in different facilities across Australia.
Yes, it's offered in Australia.
Yes.
There are many women who've conceived with frozen eggs.
Frozen eggs.
Yes.
Oh, wow. Okay. So does that mean the quality of the eggs will not reduce its quality? The eggs will not reduce its quality?
No, because it's harvested when the quality is really good and it is kept in conditions that maintains the quality of the egg. And we do not freeze one. So we increase our chances by freezing many, even if at the end of the day, you want to only have one child. Yes.
And for the sake of the men, you can also freeze.
This is your sperm.
Yes.
Yes.
And can that be a part? Can it also be like, can it be a part of family planning? Can it?
No,
it's not.
No.
We don't address it as a part of
family planning. It's more on the fertility journey as opposed to contraception. Yes.
And now, how can we prevent? Can it be prevented? Can infertility be prevented, or do we manage it? Or how can we go about it? Because like right now we've learned that yes, infertility is there. We cannot escape that. So is there a way we can work around it that it's not affecting this?
Yeah, it's possible. Now, we should say for you to get pregnant, you must have sex. If you're a couple. Now, so I'm saying because sometimes you get a couple, they're trying to get pregnant, but the intercourse is not frequent. We actually advise 3 times a week for you to get pregnant. Understand your cycle. The menstrual cycle. Right now we have digital space. You can download apps that will help you understand your menstrual cycle. So that you time, even if your man is working away from you, you know that this time is when you're ovulating. So I either need to go or he comes. So that you time that fertility period. To add on that, we've mentioned about lifestyle changes. Have your balance diet. Of course, reduce on sugary foods. We've discussed this a lot. Sugary foods and carbohydrates. Those ones affect almost every part of your health. But vitamins, proteins, supplements, those ones are good. Seek medical advice early enough. If you guys have been active for a year, 1.5 years, don't wait for nature to take its course. Because time flies. And you cannot reverse time. So you go seek medical attention from your gynecologist. And they will advise if you're normal, all the tests are okay, you'll be given options. So if there's a problem, you'll be given options as well. Yes. And of course, the other bit she also mentioned, exercise. Very important. There are some women who come, they have not conceived for like a year. And you just put them on a program of reducing their weight, exercising, diet, and boom, they get pregnant. Without any drugs. So it can be prevented. Infertility can be prevented. There are those cases of fibroids. There are many women who have fibroids and they conceive. And there are some who don't conceive. Maybe the fibroids are blocking the tubes. Now, if we find that you have fibroids, we might actually advise you on what to do. Before now the fibroids become bigger. Yes. But of course, we don't advise anyone to get pregnant when they're not ready. Because pregnancy is a lifelong decision. Yes.
just to add on to that, he mentioned having regular intercourse, and then he mentioned something about distant marriages or distant relationships. A lot of times we advocate if you can have consistent sex and if you can manage one of you to relocate and actually live with the other person, will add the chances. Remember the thing we call stress hormone. So if I am moving through a bus or SGR or airplane, probably that could be a result of stress, and then I'm not able to conceive. So yes, if it's possible, let it be consistent and in the same location. Yes. Same location, I do not mean one place in the house. I mean same location in terms of geographical.
Yeah.
Yes. The other thing is he mentioned about how much can you try or how long can you try before you say you have an issue. So we use the cutoff age of 30. So if you're below 30, try for a year. If it's not happening, you need to see us. If you're above 30, try for 6 months. And if it's not happening, you need to see us. Yes. So don't just say, 1 year, I don't think it's long. Maybe we can try. No. Yeah. So remember that age, 30.
And can somebody self-diagnose infertility?
I do not want people to self-diagnose themselves. I think it's a quagmire that we are facing as healthcare professionals, because we are not saying do not read Dr. Google, but it really interferes with the discussion I want to have with you, because Dr. Google does not know faith. It generalizes. It's women. Your issue is not X's issue. Your issue is totally different. So yes, read around issues of infertility, but when you come see your gynecologist, have an open mind. Let us diagnose you. Allow me to demystify some of those myths and things that you've read online, so that we both also have an educated opinion of how to deal with your issue. Yes.
I mean, we know most of the time we tend to self-diagnose before you go to the doctor. Niliambiwa, nikaambiwa, nikasoma, nikaona. So it's something that we really need to make it a point of visiting the gynecologist, because, like you said, it's a problem that you guys are really facing in medical health, whereby people hardly, na akikuja, instead of them listening, tunakwambia, shida yangu ni hii, hebu nipatie dawa. And yet you might find it's probably just a delay. It's not that they're infertile, it's just a delay in it. And what kind of tests are important for people to take? You can probably just shed on some light. Both of you, what tests are important for people to take before?
So I'll take the women's side, not because I'm a woman. It's fair. So there are several tests. Like we said at the beginning, the causes are many. So aligning that to the causes, then we have hormonal, what we call fertility hormonal profile. So we'll ask you to go through those, so that we find out if one is affected and if there's something we need to do or there's a modification in your lifestyle that we need you to take. So, and then we have HSG. For the sake of the audience, do not let me say it in full, but basically it means a test that checks out your tubes. Is there a roadblock? And if there's a roadblock, is it so bad that I need to do something about it? Or do I need to give you the option of IVF, AI, or some other technique of getting pregnant? Because nowadays we don't want to try so much to unblock the pathway, because our ways of unblocking the tube sometimes also causes them to block some more. So it depends on how severe the blockage is. Then the basic one that we do for all women that come to us with infertility is pelvic scan. So to just look at how is the house, is there anything that could be, is there an infection, is there, the fibroid can be inside the uterus, and hence the baby wants to come, but there's no place for the baby to live in. So that then does not become, implantation does not happen. So the fertilization has happened, but it cannot fix into the house. Okay. So, and then, I think basically that's it for the women. Yeah. Then let Karanja address the men.
The boy child.
Yeah.
Now, for the man, although most of the time we see women who are the first one to come, but we shall advise, come with your man. Now, some of the causes let me try put it very simple. You have the testicle where the semen is manufactured.
Yes.
So if a man has a problem of fertility, the problem can either be the testicle, before the testicle, or after the testicle. I'm trying to simplify it for. Now we have the hormones that are produced by the brain and other body parts. So that one we say it's pre-testicular. So if you have a problem with the hormones, it will not stimulate the testicles the right way to manufacture the sperms. That is the first part. So there are tests you do. Call them hormonal tests. Many people know as hormonal tests. Now, you could be having very normal hormones, but now you have a problem within the testicles. That the manufacturing of the sperms is not okay. Maybe it's a problem of congenital, you are born with it. Maybe there was an injury along the way, you had surgery, or trauma, you had an accident and the testicles were affected. Maybe you had an infection before, or you have a current infection and the testicles were affected. Maybe the blood vessels that are supplying the testicles have a problem. So that is the testicular bit. So most of the time we do a scan. So we do a testicular scan, we check if everything is normal. Now then after the testicle, we have the post-testicular. So this means the sperms are produced well, but now the transportation into the penis and into the womb. Yes. There could be a problem in between there. And there are tests we do for that. So when a couple comes, the first test you do for a man, we call it semen analysis. So we analyze the semen. Do we have the right number of sperms? Do you have the right quality of the sperms? Are the sperms normal? You know, the sperms have a head, has a tail, and the middle part. So how many of them are normal? And the other thing you look at, can the sperms swim? Because the sperms are deposited in the vagina and they have to travel
all the way
up to the. So sometimes they can be moving, but zinachezea. So they have to swim forward into the. So that test looks at if the sperms are normal. Now, if you find the sperms are normal, now you look for another cause. Most probably the woman's side. But if you find the sperms have a problem, now you look at what is it that is causing that problem. So you do hormonal tests and you do a scan of the testicles. So those are usually the main three tests you do for the man. Semen analysis, you do a scan of the testicles, and you do a test of the hormones.
Maybe just to add on that, at times we also need to involve our other colleagues, that is the urologists, so they really help us with finding out if there's an issue with the path. Barabara ambayo sperms inafaa kupitia. So yes, sometimes don't feel bad when we send you to somebody else, because we need to help you. And that help might come from my colleague guiding me on, is it really valid that I give you something to boost your sperms, or he needs to do something about the pathway?
Thank you for shedding light on that. Because it's something that tunajua kama ni gyna and atadini ni kila kitu, but there are points where we also need to see others for us to also get help. For you to get there, to also get the information and for us to also get the help.
Yes.
And know what happens when nimepimwa, the tests have come normal, but probably a year later, but don't feel I'm not able to conceive or my husband is not, what could be the cause for that?
So that's, remember the point where we said unexplained infertility?
Yeah.
So sometimes it's a wait and see, but then we give you a time limit, especially related to your age. And sometimes when we look at your age and we feel like, no, we cannot make you wait any longer, then we refer you for now the other ways of getting pregnant. So IVF and artificial insemination. That's an option that some insurances cover for certain people that work in certain places. But it's something that if you're walking the journey of infertility, I would say it's worth investing in, especially if you really want a child. Yes, it's expensive. Like Dr. Karanja alluded to before, when the demand goes high, we might have the expense getting lower. And as the interest of we as gynecologists is growing towards the area of IVF, meaning we'll have more expertise in IVF, the cost will also come down. Because actually the issue could be also the fact that we do not have the enough expertise in the field, but the interest is really growing. From our colleagues, we are seeing a lot of people now pursuing that as a subspecialty. So yes, there's good news. And we hope that very soon we'll have that IVF or AI service close to you.
Maybe just to add on that, see with IVF, it means the sperms and the egg of the woman, the fertilization happens outside in the laboratory. Then whatever forms is transferred back to the womb. In terms of the expense, yes, it's expensive, but look at it this way. You're 30 years. Then you go see many doctors. Then 5 years down the line, you've not conceived. So what is the cost of waiting for 5 years? Can you plan the money issues within 2 years? Know how much it is? If you try like 2 or 3 doctors and it fails, you opt for IVF. It might look expensive, but in the long run,
that's
true. It could be cheaper than just waiting and moving around. Getting to see all the doctors, sometimes even herbal medicine men. So you have to look at all the factors. Yes.
Thank you so much, Madaktari wetu. You have tackled a section that is really, really sensitive. Na watu wamekuwa wakiuliza. We discuss zingine, but they'll still come back here. What if? And I thank you so much for being in studio today. Thank you for shedding the light on people. I hope you have learned something. I hope you've really, really learned. And kama kawaida, daktaris wako hapa. You will find them at their places. Modern Gyno Clinic, Jubilee Building, Moi Avenue, Mombasa. Mutawapata pale. And this was us today. Asanteni sana kwa kukuja. Asanteni kwa kujibu maswali. And for any further questions, mutawapata pale. They are ready to help you. They're ready to assist with you. You will find us on our social media platforms. Hapo tu chini. Hapo. Our contacts are also there. You can visit us also. Asanteni sana.
Thank you.
Thank you.
Asante.